I'm Thomas Meek, and in today's PMLiVE podcast, I speak to Kash Mahmood, who is Director of Group Digital and Healthcare Technology at Alliance Boots. This conversation took place at Think Digital 13, a conference hosted by Digitas Health that centred around mobile communications and healthcare. Kash was presenting on the impact of mobile health on pharmacies, and this conversation expands on that theme.
Kash Mahmood, Head of Technology Strategy, mainly around digital and healthcare for Boots UK, taking on more of a role across Alliance Boots as a group.
And can you just give a brief overview of how mobile health is used in pharmacy at the moment?
Sure, yeah. I think there's several different areas of use, really. I think there's the use by pharmacists themselves, so pharmacists being able to access information, maybe more information about what the issue is that the patient is having, being able to look at images, being able to look at drugs information, all of this. And really they're using sometimes their own devices in the pharmacy world, and we see this increasingly in Boots, to access information like that. So it's brilliant, it's fantastic. I think there's a need to give them the right tools and really allow them to communicate and collaborate themselves. There's then the use by customers, consumers, patients, and that's really around several different things. One is the use of mobile phones and devices to manage your drugs, be able to reorder drugs, be able to get reminders around drugs, and really increase adherence to drugs. We know that 50% of patients don't take their repeat medications on time every time or follow the instructions. So this can really help in that place. And then we go on to more on the changing role of the pharmacist in providing healthcare services, especially around the long-term conditions. And this is where the mobile phone can really start to play.
Yeah, so could you just expand a little on the sort of rise of chronic diseases and how mobile health and pharmacies can work together to address that?
So I think obviously in the UK there's a changing role of a pharmacist. The NHS wants to push pharmacists into more of a role of providing services, helping patients end to end, and clinical commissioning groups are really pushing this in local areas and regions with the any qualified provider route. Pharmacists can really help drive the usage of mobile phone to help support those services. So, for example, apps around diabetes, around asthma, around smoking cessation. But really, what we don't want to see anymore is the great plethora of apps, some of which are sometimes slightly gimmicky, some of which have a usage which drives up at the beginning and starts to fall off. We want to see ongoing use and really ongoing better care for the consumer. So this is really when we start to need a more integrated manner across the UK of healthcare advice and healthcare applications and the ability to manage your health, then being able to communicate with a patient health record or patient health records across the UK.
How do you see the relationship between pharmacy and patient developing over the next few years? Is that going to get closer, do you think?
Absolutely, yeah. I mean, there's a number of things really. So one is the ability to communicate and call someone for advice. So if we take the mobile phone out, it's the most basic need, calling 999, calling your parents for help, calling the pharmacist for help. And this starts to evolve into more remote diagnostics, remote chat, being able to communicate with someone around your condition, especially if you've got a long-term condition. That person could well easily be the pharmacist, especially as they move more into a healthcare services and provision role. The second bit then is really around how the patient communicates with the pharmacist when they come into the store. So if they're using an app and they have a patient health record, then it's really around how the healthcare professional gets access to that data, is able to help with tracking that data over time, and that could be a pharmacist, it could be a GP, and really what we want to see again is that integrated journey so that it's not a separate bit of technology from many different providers, but it's an integrated offering that's well immersed into the UK infrastructure around healthcare.
And finally, just how do you see the pharma industry working with pharmacies over the next few years? How is that going to change?
I think there's a number of areas. One is around adherence to drugs. So obviously, with many people not taking their drugs correctly, what we want to see is better adherence to drugs. It improves patient care. It also helps pharmacies and pharmacos around stock management, around understanding their drugs better. So there's the adherence to drugs, and I think we can definitely collaborate more on that going forward. The second bit then is really around being able to carry out clinical trials and really, if the pharmacy has direct access to the consumer on the high street, which is which is fantastic and really can help pharmaceutical companies to be able to access consumers, to be able to carry out trials, to be able to understand their conditions better. And that really links us to the third piece, which is around big data, data information management. So how do we effectively integrate the same bits of data across a subset of the UK population to understand that subset better, right from the production of drugs to be able to wholesale them, to be able to retail and pharmacy them, and then being able to take them.
So thanks a lot to Kash there, who was speaking at Think Digital 13, hosted by Digitas Health. Find out more on PMLiVE.com, where there's a blog about the subject, and also lots more content about that event and the learnings from that. So keep an eye out on PMLiVE.com.